The purpose of this video is to understand the difference between various types of walkers and provide a general guideline on how to properly fit them based on patients' weight-bearing status, presentation, and condition. The first type of walker is a standard walker. Patient ambulates with 6 points of contact to provide stability. However, patients need to pick up the standard walker from the ground to advance. Then it becomes 2 points of contact and patient is carrying an object at the same time. This yields instability and safety concern. A rolling walker is the type of a walker that therapists promote to use. It has wheels in the front which facilitates advancing and maintains constant 6 points of contact. It does not need to be lifted off from the ground, and it promotes normal gait pattern and energy conservation. This is a platform walker. It is used for patients with non-weight-bearing status on the wrist, and PT staff can assist with the setup for this specific device. The weight capacity for a regular rolling walker is up to 300 pounds. For patients who weigh more than 300 pounds or patients with wider hips, they can use bariatric walker, which weight capacity is up to 500 pounds. The height recommendation for rolling walker is 5 feet 2 inches up to 6 feet 4 inches. For the patients who are shorter than 5 feet 2 inches can benefit from using petite walker. Therapy department petite walkers are usually labeled or taped with green color, and bariatric walkers are usually taped with blue. When donning a gait belt, pay attention to patient's center of mass. We want the belt to be placed as close to their center of mass as possible. Gait belt is usually placed around either their waistline or axillary region, depending on patient status. We need to avoid placing the gait belt over an area that cannot have pressure applied, such as ostomy bag or G-tube. Gait belts should be snug but not overly tight. About 2 fingers should fit between the patient and the belt. Secure extra length of the belt by tucking it into the belt to keep it out of the way. For sit-to-stand transfer from a bed, bring the walker as close as possible in front of the patient. Patient might attempt to stand up with both hands placed on the walker. Educate the patient on proper hand placement. One hand should be placed on the handle of the walker and the other hand should be pushing off from the bed. When grabbing the gait belt, always use an underhand grip to offer a stronger grip and reduce your risk of injury. When fitting a rolling walker, the hand grip of the walker should be evenly aligned with patient's wrist when they are standing up erect. You can use a general reference by obtaining patient's height and compare the patient's height to yours and adjust the height of the rolling walker accordingly. When the rolling walker is appropriately adjusted, patient's elbows should be bent 15 degrees to 20 degrees when grabbing onto the hand grips. If the hand grip is aligned even with the patient's wrist or hips, then it is properly fitted. Check the tightness of the gait belt one more time and adjust accordingly. For ambulation, educate patient on proper distance that should be maintained between the rolling walker and themselves. A good rule is to have the walker no more than 1 step length in front of the patient. Patient might attempt to pick up the rolling walker from the ground. Educate the patient to roll the walker to facilitate normal gait pattern and ensure their safety. When patient has a non-weight-bearing order, advance the walker about 1 step length away and swing forward into the walker with non-affected leg. Make sure the affected leg is off the ground at all times. When standing up from a chair, patients should scoot forward so both feet are touching the floor. Place one arm on the armrest of the chair and the other one on the rolling walker. Push up to a standing position. Once standing, transfer both hands to the rolling walker. To use the toilet with the walker, patients should approach the toilet backwards. Once properly positioned in a good sitting distance, place one hand on the rolling walker and one hand on the grab bar to sit down and stand up. For male patients, they can approach the toilet in a forward direction. Once properly positioned, they can be instructed to use the grab bar for stability. Patient might attempt to neglect the rolling walker by placing it to the side. Educate the patient to walk up all the way to the sink while using the rolling walker and place it directly in front of them.